We are recording. Okay, so let's begin. Hi, everyone. Thank you all so much for joining us. This is the COVID-19 training, a resource for DSPs, providing care to people with intellectual and developmental disabilities. I am going to begin sharing my screen. Okay, I hope you all can see the screen clearly. Okay, so as you can tell by the title, this training is going to be for all direct support professionals, whether you have been in the field for many years or if you are brand new. My name is Michael Siegelman. I am the nurse educator at DDS's Developmental Disabilities Administration, and I will be guiding you through this training. So for all of you all attending this session live, you all are either quality directors, Qs, RNs, or RNs and directors of nursing of your provider. This is going to be information that you most likely already know, most of it that you already know, and also information that you have probably already taught or trained your DSPs on. But this training is really going to be for everyone, not just DSPs, but anyone at your provider agency. Please enter your questions in the chat box, and I will check it every so often and answer questions as we move along. So as I said, this may be a lot of this is a lot of information, and it may be some things that you already know. However, we want to make sure that this information enters your long-term memory. And in order to do that, we need to repeat this information. So you will be learning this information from your DONs, your RNs, as time progresses. Also, if at any time you have questions, please talk with your supervisor, your supervising RN, your DON, or please follow your employer's policies with who to speak with. You can also always stay updated independently on your own, learning more by visiting coronavirus.dc.gov. And so for everyone attending here live, I will be speaking as if I am only speaking to DSPs for now. But this is a training for everyone. This is also a training for you all to either use in the future for future trainings, which DDS will be requiring. They'll be sending out information to you about what is required. Or you may develop your own training. But either way, you will be you can use this or develop your own training, but this is going to be a reference for you. Okay, this presentation is going to provide information for you as you provide care to people with intellectual and developmental disabilities. It's going to include information on hand washing, when to wear your mask, taking mask breaks, preparing food, and what is recommended when you are not at work. We will be dividing halfway through the presentation, we will be dividing the information into time frames. So what happens before you come to work, what you do while you're at work, and what you're going to do after work or while on your personal time. Okay, so as most of us are aware, there are two ways that you can get COVID-19. There is person-to-person contact, and there is contact by touching a surface or an object that has COVID-19 virus on it. For person-to-person transmission, the person doesn't have to be showing signs of the COVID-19 virus to spread it. Some people don't know that they have the virus because they don't have any signs, and then therefore they wouldn't suspect anything. And that is called, when you're not showing any signs, that is called being asymptomatic. And it is for this reason that we should remain 6 feet apart from people, whether you do have symptoms or you do not have symptoms. Remain 6 feet away. Therefore, you have less chance of spreading the virus and less chance of becoming infected with the virus. One very important thing to remember while we're talking about person-to-person transmission and people who are not showing signs is that the person not showing signs and potentially spreading the virus could be you, which is all the more reason to follow CDC and DC health recommendations. The second mode of transmission is contact with a contaminated surface or an object. The way this happens is someone with COVID-19 maybe coughed in their hands and then didn't wash their hands afterwards, sneezed in their hands, or touched something that had COVID-19 on it, and then touched something else. And then you touch what the person touched. So I sneeze, I touch my computer, someone comes by and touches my computer, then they touch their face. That is another way of how they can get COVID-19. So there are some actions that we can do to prevent getting COVID-19. And it's not incredibly technical. It's not difficult. Hand washing is the first line of defense. By washing your hands with soap and warm water, you're washing off the virus from your hands and not allowing it to enter your body if you happen to touch your face. We all touch our face. I've caught myself many times during presentations touching my face. I have, however, just washed my hands right before starting the presentation, so I know that my hands are clean and I'm not outside and I'm not touching anything else. Make sure that you wash your hands and that you do not touch your face. Also, covering your face prevents the spread of COVID by preventing the particles that are naturally expelled from your mouth from getting into the air. I forgot to mention when you're not touching when you touch your face, that provides that opens up the mode of entry for the virus to get into your body. Our mucous membranes are our eyes, our nose, and our mouth. And if we have the virus on our hands and we touch any of these three places, the virus then enters our system and enters our body. Staying 6 feet apart prevents the particles from getting into your eyes, nose, or mouth. The most current research states that the expelled particles don't really remain floating in the air past 6 feet. They fall to the floor or to the ground. I'm sure you have heard that they have found that particles may go further than 6 feet, but as of right now, the best the best information is and the most helpful and most beneficial is that 6 feet is the distance that is believed to being 6 feet away is the best distance to be from people, minimum of 6 feet. And then lastly, cleaning and disinfecting. That prevents the particles from remaining on surfaces that are touched. If a surface is thoroughly cleaned and disinfected, then we're reducing the potential for the virus to have the chance to enter our bodies. Let's talk about types of face coverings. We have cloth face covering, the face mask, the respirator, and eye protection. The cloth face covering is a handmade cloth mask or a store-bought fabric mask or a bandana or something along those lines. A face mask, also called a medical, surgical, or procedural mask, is reserved for healthcare workers and other professions that might require their use. A respirator, sometimes called an N95 respirator, these are specialized medical supplies, and they're reserved for healthcare workers and other professions that might require their use. And then let's also mention face masks and respirators with valves. This is not recommended. This valve is basically an opening. I know that there's usually a filter in this, but this is basically an opening that allows the virus to leave the area between your face and the mask. And we don't want the virus to leave that enclosed area. So these are not recommended. Okay, and then we also have eye protection, and eye protection would include goggles or face shields. DC Health will be coming out with more precise, exact information about which types of goggles or face masks are advised, but please note that glasses are not acceptable eye protection. Glasses are not acceptable eye protection because there is a space between your face and the lens of your glasses. With goggles, goggles that are the correct goggles that do not have any space, any holes for the virus or the expelled particles, respiratory particles, to enter that space. Those are the types of goggles that are the correct ones, the ones without holes. And so your supervisors, your either the supervisory nurse, the DON, or the Q will be the people to talk to and to go to find out which goggles or which face shields are applicable. I have a number of pictures here of face shields and of goggles. Please note that, let's see, where's the one? This one here on the right has a space for the person's name. This is to reuse the face shield. We realize that there may be a decrease in supplies or concerns about buying enough face shields. And so you may speak with your supervisors about reusing your face shield. You're not going to be sharing face shields. So the face shields can be cleaned and reused by the same person. Okay? We are not sharing face shields. Same goes for goggles. Do not share these supplies. So we have a number of different types of face shields on the top row. Please note that I'm not telling you which specific brand or which kind to wear. I just want to show you a number of different face shields. On the bottom row, just like this picture here on the left, we have a number of different goggles. These do not have holes in them. You want to make sure that they are approved goggles, as I mentioned earlier. And please also note in the bottom right-hand picture that this person is wearing goggles over their glasses. If you need to wear glasses, goggles should fit right on top of the glasses. As I said, glasses are not approved eyewear. Okay, so further along in how to keep yourself from getting COVID-19, a face covering is required the entire time you are inside working with someone. So when you do remove your face covering, you should put it in the trash if it's disposable, or you should store it in a breathable paper bag when it's not in use. And that would be like a brown paper lunch bag would be a good example. And that is because we want to make sure that the mask is drying. So you're not going to put it in a plastic bag because it wouldn't be able to dry as well as it would in a paper bag. Be sure to avoid touching your face when removing your face covering, and after removing your face covering, wash your hands immediately. Please be advised that you don't need to wear gloves when you're working. Gloves could accumulate the virus and germs, and therefore you could further spread these germs. The reason you would further spread the germs is because we are less likely to wash our hands when we are continuously wearing gloves. And I don't really know how effective it is if you are using hand sanitizer and you're wearing gloves. How effective are you at removing the virus when you're wearing gloves and washing your hands with hand sanitizer. So you shouldn't wear your gloves all the time while you're working. You should only wear gloves when it is required, and we'll talk about that shortly. I'm going to check the chat box to see if there are any questions waiting for me. Okay, someone is saying that they can't hear me. Would you please let me know if you can hear me? Can someone just give me a yes through the chat box? Great. Okay. So the person that wrote that, you might want to log out and then log back in, or you might want to check your settings on your computer, not only the WebEx setting, but also your laptop or your desktop's computer. Somebody else asked about receiving this handout. This is being recorded and it will be on our website. So yes, you will receive this handout. Also, please feel free to take screenshots of this presentation as I'm going along. Please feel free to take screenshots. Okay. Somebody asked this question, a clarifying question. Should face masks also be worn when providing direct supports outdoors as well? The slide indicated indoors, while our agency policy is based on guidance that we should wear them during all direct support time. That is a fantastic question. When you are outside in close proximity to someone, for now, that's a great question. I'm going to have to get back to you on that. I am going to say no, you don't need to wear. Oh, I'm sorry. You said face masks, not face shields. Face masks, yes, you should wear them while you're outside as well. Absolutely. Can eye safety wear shaped like glasses be used? Well, the whole point to eye safety wear is that they're completely enclosed. So that would mean that there isn't any gap when you are wearing the goggles. Let's go back to this photo here. There isn't any gap between the eyes and the goggles. So if you think about glasses, there's a large gap between here and here when you're wearing glasses. If there aren't any holes, if the I mean, this picture on the left is shaped like glasses, if that's what you're referring to. I'm not quite sure. I guess I should ask you to clarify that question. Um, Can the person that wrote that clarify that question for me? What do you mean by eye safety wear shaped like glasses be used? Because this is shaped like glasses, the one in this picture here. I'm going to keep moving on and then I'll get back to those questions. Okay, this is a very helpful slide. It's a very simple slide. Um, Isolation versus quarantine. They are two very different terms. And the way to remember this is that I stands for isolation, and it also means infected. Q stands for quarantine, and that means questioning. Please feel free to take a picture of any of these slides, this slide or any of the slides that I've been presenting. I, isolation, infected. Q, quarantine, questioning. So for isolation, this is for people who have tested positive for COVID-19. The separation is to prevent exposure of others to COVID. Isolation is no longer specifically ended based on test results, but now it is on symptoms. And I want to direct you to the communication that was sent out by DC Health from September 15th, explaining isolation, quarantine, and removing someone from being in isolation, and what are the parameters for that. Keeping in mind, by the way, that this information can change and has changed. So please make sure that you are reading the most up-to-date information on their website. Providers should consult with the person's primary care physician to determine when isolation can be safely ended. So if it's been, let's say, we're talking about 14 days or 20 days, you want to also speak with the doctor and make sure that the doctor is in agreement that the person can be removed from isolation or quarantine. Okay, for quarantine, this is if a person has been exposed and they are required to self-quarantine for 14 days. This is regardless of whether a test result states that they are negative. Okay, so an example would be if they are negative at day 10, for example, they still need to be in self-quarantine for 14 days. So a confirmed exposure must result in a 14-day self-quarantine. Also, the link at the bottom of this slide is a health notice from August 3rd. It includes some information about who's prioritized for testing. And then, as I said, the September 15th communication that DC Health sent out would be the most recent as far as how to test and when to remove them from their quarantine. So some basics on personal hygiene, and I know that most people know this. Wash your hands frequently and thoroughly. So often and thoroughly. Cover your mouth with a tissue or by using your elbow when you sneeze, cough, or blow your nose. And do not touch your face with your hands. As I mentioned before, the reason we don't touch our face with our hands is because of the mucous membranes of the eyes, the nose, and the mouth. I have said this many, many times, and I'm going to say it again. When you wash your hands, you want to make sure that you wash your hands for at least 20 seconds, and that is the time that it takes to sing Happy Birthday twice. Okay, so when you're doing that with soap and water, and warm water, you want to turn on the water, get your hands wet, put on soap, and then start Happy Birthday song twice. Okay? You want to make sure that you have covered every surface of your hands. This is a picture of, I believe it was 10 seconds of hand washing on the left versus 20 seconds on the right. Okay, so as you can see, the lighter part is where the virus or germs are. All right, and you'll see on the left-hand picture that near the joints, the person missed where the fingers meet the palm. In this little indentation of the palm was missed, and around the sides, the sides of the fingers were missed on the left-hand picture. On the right-hand picture, the person did a really great job washing their hands. We don't see any of the virus or the germs. Okay, so what do you do if you don't have warm water? Do you not wash your hands, or do you wash your hands with what you have? So the CDC states that if you don't have warm water to use for whatever reason, it's still beneficial to wash your hands with soap and water, whether it's cool or cold water. That's more beneficial than not washing at all. So wash your hands with what you have. Okay, let's talk about hand sanitizer. Be sure that it has at least 60% alcohol. And remember that you can use hand sanitizer if you don't see dirt on your hands. I also have written here when soap and water aren't available. If it just so happens that you don't have soap and water, use hand sanitizer. But you can also use hand sanitizer if you don't see dirt on your hands. And when using hand sanitizer, be sure to remember to rub your hands until they are completely dry. This is the time that it takes to effectively kill the virus, the germs, the bacteria on your hands. You want to make sure that you clean all over your hands, including the tops and the bottom of your hands, the fingers, your thumb, and between your fingers and your thumb. So I'm going to do a demonstration with my hand sanitizer. This one has 70% alcohol. It says 15 seconds of hand washing. I've seen a lot of people just put a little teeny weeny drop of hand sanitizer on their hands, and that's not going to keep your hands wet for the amount of time that you should wash your hands. If your hands dry within 5 seconds and all you're doing is going like this and they're dry, you did not use enough. The container may say to use a dime-sized amount, a nickel-sized amount, a quarter-sized amount, or maybe an entire squirt. I always use at least an entire squirt. Okay, so I'm putting the hand sanitizer in my hands, and I'm going to rub the palms together. I'm going to rub the tops of my hands together. I'm going to go between my fingers and between my thumbs. I'm going to go around each finger and around each thumb. My hands are still wet. Going around each finger and each thumb. They're still wet. I haven't sung happy birthday twice, but I know it hasn't quite been 20 seconds yet. Okay, they're almost dry. And there. Okay. Let's check the chat box for a moment. Somebody else asked about the PowerPoint. The answer is yes. This will be available. Somebody said that with the valves, you have the ability to open and close the valves. Can it still be used if you can? So I'm not the person to answer that question, really. If a monitor comes and sees that a mask with a valve is being used, what if it, I don't know how it opens and closes. I mean, if it closes fully, then it would be effective in preventing the virus from getting out from your face through the mask, but some people might not be aware of that. So I would say that you shouldn't use it, but that would be a question for for us to inquire with DC Health, actually. So the person who was asking about the glasses, to clarify, they're wearing safety glasses with a face shield on. Huh. Okay. I've seen in hospitals staff wearing protective wear for their eyes shaped like glasses, but are not goggles. To clarify, they're wearing safety glasses with a face shield on. So I think if you have the face shield, that is your coverage for the as far as eye protection goes. Wearing the face shield, not wearing both safety glasses and a face shield, if that makes sense. Let me know if that makes sense to the person that wrote that. Somebody else wrote, how many times should face shields be reused? Well, if there is first of all, that also has to be factored into your provider's rate. So how many employees, how many times people come in and out for shifts, and how many times if they have to take it off and put them back on, does it make the elastic wrap that wraps around your head, does that stretch it out? Does that make it more difficult to use effectively? Also, you have to factor in how the integrity of the shield is. So if it's become dented in, if it's become foggy for whatever reason, if something got on it and it's no longer clean or effective, that is going to have to be factored into that. I would say if it's still in good shape and it's used correctly and it properly blocks the person's face, it can be used. I can't imagine why it wouldn't be used for at least a week. or I should say reused for at least a week. But that is not a definite number because I've never worn a face shield. So I will add that to a question to ask for DC Health. Okay. All right. I'm going to keep going because I'm going to run out of time if I answer all these questions, unfortunately. So I'm going to keep going and then I'll answer the questions as soon as I can. Okay, so let's have a little discussion about what we do in our personal lives. A great question to ask yourself is, what does our morning look like before we come to work? And the reason we're saying this is because we want you and everyone you're providing care for or assistance to remain as healthy and safe during this pandemic. And this means following some of these, some standards as much as possible in your personal life. And that includes being mindful of social distancing if on the metro or on the bus while going to work, not hugging a neighbor or shaking the hands of a neighbor you've run into, whether, if you haven't seen them in a while, stay 6 feet away. Being mindful of what you touch if you have to run into the grocery store. Let's say you're going for picking up a snack for your afternoon for work. You don't want to touch multiple things in the grocery store. Go in for what you need, pay, and leave. I have found myself in grocery stores doing what I used to do when I worked in a surgical setting, putting my hands like this, not right in front of my face, but putting my hands together and walking around the grocery store like this, so that I don't touch things because I'm a toucher. Okay, not touching your face when you're out, not touching your mask when you're out, and washing your hands before entering work. You should wash your hands right before you're entering. Okay, so be sure that you're following your provider's policies and procedures for checking your temperature and who to call if you aren't feeling well. So this is concerning the screening that all providers should be doing. So if you're feeling sick, don't come to work, call the person that you are supposed to call. Some signs or symptoms include a temperature that is greater than or equal to 100 degrees Fahrenheit, coughing, difficulty breathing, feeling fatigued, having body aches or having a headache. You have a sore throat. You have a new loss of the sense of taste or sense of smell. You are experiencing nausea, you're vomiting, you have diarrhea, you're experiencing congestion or a runny nose. Any of those things, please follow your provider's policies and procedures. As I said, you're going to wash your hands before work or as soon as you get to work, and you're going to wash your hands the way I told you, with soap and warm water or with hand sanitizer, and you're going to wear a mask. And so when should you wash your hands? You should wash your hands before and after eating, before and after using the bathroom, after touching anyone, and that would include when you're providing assistance with ADLs, or if you if you forget and you accidentally touch someone, touch their arm or their shoulder, you need to wash your hands after that. Touching any surface that might have COVID-19 virus on it, after coughing or sneezing, and after blowing your nose. So to answer this fourth bullet about touching any surface that might have COVID-19 virus on it, what might have the virus on it? How do we know? How do we know if it has the virus on it? Anything could have the virus on it, and we don't know. These are microscopic. We can't see them with our eyes. So wash your hands often. While you're at work, you should do a number of things. You should ensure that the people you're providing assistance to are washing their hands with the same frequency and the same method that you are washing your hands with. and before and after the same activities. So before and after they use the bathroom, before and after eating. If they touch something, you want to really encourage them to continuously wash their hands. They should be doing the same thing that you're doing. Also, a great question is, are there visual reminders in the home, in the person's bedroom, in the bathroom for them to wash their hands frequently? And do these visual reminders explain the proper technique? If the person is independent, if they're able to read, and if they're able to wash their hands without reminders or without assistance, you could have these reminders in their bedroom, in their bathroom, in the kitchen, in the living room, on the coffee table in front of the TV. You can have all these reminders and leave a bottle of hand sanitizer there for the person to use frequently. When I see this sitting on my desk in my home, I know to wash my hands, and I do it often. This hasn't lasted very long, despite the huge size of the bottle, and it shouldn't last very long with how frequently we're supposed to wash our hands. Another question to ask is, where are the bottles of hand sanitizer placed? Are they where people frequently walk? And that would be to help remind them to wash their hands often. While you're at work and you're touching food, what should you do properly? You want to make sure that you wash your hands thoroughly before touching any food, bowls, utensils, forks, spoons, knives, any drinking glasses. Okay. You do not need to wear gloves while making the food. You've just washed your hands and you're not going to touch your face. So when you wash your hands thoroughly and correctly, there's no need for you to wear uh, uh, gloves. You should only wear gloves when you're feeding someone if you think you'll be exposed to bodily fluids. Okay. Um, and when the person is finished eating, you should wash everything in the dishwasher if you have one. And if there isn't a dishwasher, you should wash it all in hot, soapy water. When you're washing things in hot, soapy water, I would recommend that you use maybe those thick Playtex gloves that people use to protect their hands from getting too dry from the hot water. That's because the hot water and the soap could easily dry out your hands, I should say. Always finish when you are washing in the kitchen. Always then finish again with washing your hands thoroughly before moving to another activity or working with someone. So when I'm doing the dishes after cleaning up after the kids have had their meal, and I'm doing the dishes, I'm putting everything in the dishwasher and I'm cleaning the counter, my hands are covered in soap. I realize I rinse my hands off, then I properly do the entire process over again. I pump the soap into my hands, I wash my hands for 20 seconds, and I entertain the kids by singing happy birthday in odd ways, different ways every single time, just to get them to pay attention and see that I'm doing it too. And then rinse my hands. And remember, when you are drying your hands as well, to use paper towels are the best because they have not been used yet, and blot your hands and put them directly in the trash without touching the trash container. Okay, how do you wear your mask while at work? I'm running out of time, so I'm not going to go over every single example, but I will tell you that the picture circled with a check mark and a big star with a yes on the right is the correct way to wear the mask. The other ways are not. This one is the correct way because your nose is fully covered and your mouth is fully covered. Please note that the picture second from the left is not correct because their nose is not fully covered and the mask does not go down to underneath the chin. So the only correct way is the picture all the way on the right. Okay, please feel free to take a picture of this slide. This has a link to a video of how to put on and how to remove your mask, gloves, and actually it also includes a gown and face shield. But we are talking mainly about mask, gloves, face covering, face shield. So this information is all dependent on which PPEs you're wearing while at work. And please ask your RN, your supervising RN, or your DON if you have any questions. And again, please feel free to take a picture of this so you can visit this webpage or this link. Okay, so while at work, when should you wear your PPEs? We talked about this. You're going to put on a face mask or your cloth face covering when you get to work and ensure it's on correctly and securely before starting. And you're going to put on your mask and face covering and gloves when you're touching someone if it's necessary. So if you're helping them in the bathroom, if you might be exposed to saliva, or if you're helping someone wipe their nose, or if you're helping them in the bathroom, if you might be exposed to any bodily fluids, you want to wear gloves. After removing your gloves, you're going to take off your mask without touching your face, and then you're going to wash your hands immediately. A reminder again is that you're not going to keep your gloves on all day because it could spread germs, and you are not going to use the same pair of gloves for multiple people. I realize that we were short on supplies in the beginning of this pandemic. Gloves should always be changed between people. And especially now that hopefully all providers have caught up with all of their PPEs, they have all supplies needed. Therefore, you should have enough gloves. If you need to wear gloves, you should not wear the same pair of gloves with multiple people. Always change your gloves. And despite what's in these photos, we're not going to be throwing the gloves on the ground or on the floor. You're going to take them off correctly. Visit that link that I just had a few slides ago. You're going to see how to take them off correctly, and you will immediately put them in the trash can. Okay, so if you're helping someone brush their teeth, there is a risk of you being exposed to their saliva. It could come out of their mouth. If you're assisting them in the toilet, if you're helping them eat, if you need to help spoon the food into their mouths, or if they're not independent with eating, then cover your face and wear your gloves. When a person has or is suspected of having COVID-19, you should be wearing your face covering, your face mask, whether it is the medical or procedural or surgical mask, or your N95. Okay. If you're providing care to a person who's in isolation as well, you should have your face covered. And now, as is directed in the September 15th communication from DC Health, you should also be wearing the face shield or goggles, a type of eye protection that is approved. Okay, while at work and providing personal care, if the person is in isolation, you should encourage the person to wear a mask if they're ever outside of their own space, meaning their bedroom. So if they're walking from their bedroom to the bathroom, if they have to walk out of their bedroom into a hallway into the bathroom, they should wear their mask. You should wear a mask as well to reduce the risk of infection. And you should encourage everyone in the house to wear a mask if the person is outside of their own room, such as, again, if they're going to go use a shared bathroom, or if they're out of their room for any other reason, if they have to go to a doctor's appointment, if there's an emergency and they have to leave the house, whatever that emergency might be, everyone else should be encouraged to wear a mask. Also, remember that isolation is essential to reduce the spread of COVID-19. So the person being outside of their own space would happen very rarely. As I've said, when they're walking from their room to the bathroom and back. That would hopefully be the only time that they're outside of their room. Okay, while you're at work cleaning and disinfecting, what should you do? So surfaces should be cleaned first using soap and water. And then to disinfect it, you must use an approved disinfectant. And this is going to be supplied by your provider. You're going to talk with either your Q, your DON, or your supervisory nurse, your supervising nurse. Uh, you're not going to bring your own supplies. Okay, you're going to follow your provider's policies and procedures. Remember to follow the directions on the container. Okay, read the label. This link, please feel free to take a picture of this link. This link is going to send you to a web page that provides the EPA registration number of the products that are approved. This is the List N disinfectants by EPA. So it's going to include the EPA registration number, the active ingredient, the product's name, the company that manufactures it, and one of the most important things is the correct contact time. The contact time is the amount of time the product must be on the surface to successfully disinfect. And what I mean by that is that a number of these products need to remain wet on the surface for a certain amount of time to effectively kill the viruses and bacteria. Okay, some of them may be 10 minutes, some I've seen are 5 minutes, some are even 1 minute. Okay, be sure to check the product's label so you know how long it needs to stay wet on the surface to correctly disinfect. If you just spray it on and wipe it off immediately, you are not correctly and effectively cleaning, you are not correctly or effectively disinfecting the surface. If you've been to a restaurant during the pandemic and you see someone spraying a table and then wiping it off immediately, chances are, unless the product says 1 second, chances are they are not properly disinfecting the surface. So keep that in mind when you are cleaning and disinfecting in the home. And as I said, all of these products will be provided to you by your employer. This is the same concept as when we said that you need to keep the hand sanitizer on your hands and rub it and keep it wet and rub your hands for 20 seconds until your hands are dry. It takes a certain amount of time for these products to work. The 20 seconds is what it takes to clean your hands. The 1 minute, 2 minutes, 5 minutes, 10 minutes, whatever it is that the EPA website says is how long it takes to effectively kill the viruses on the surfaces. Okay, so you're at work, you want to take a mask break, okay? That's totally fair and totally acceptable and allowed, okay? Be sure to check with your employer to ensure that you are aware of any of the policies that they've put in place to safely take a mask break. And when you take a mask break, be mindful of where you are and who you're near. If you are in a small room, that's probably not a good idea to take a mask break there, okay? It would be ideal for you to step outside into the open air. Okay, but if you can't, you should go to a room where you are alone and where you are 6 feet away from someone. And if you can't be alone, you must be 6 feet away from anyone. You're going to wash your hands before touching your mask. Remove your mask from your face without touching skin to your face. And then that's your mask break time. So take a few deep breaths, move your mouth, lips, and jaw, exercise your face, sing a tune, talk on the phone if you are on a break, on a proper break. Enjoy the brief relief from your mask, whatever you're going to do during this break. Okay. When you're finished, place the mask back on your face, and then wash your hands and return to work. So how frequently can you do this? Be sure to check with your employer to make sure that you know about the existing policies for the frequency of taking mask breaks. If the person you are accompanying or assisting receives one-to-one assistance or two-to-one assistance, whatever the case may be, ensure that the person has that required coverage before you leave for your break. This is just like you've always done. You're not going to leave someone who needs who needs you, who is required to have you there. You're not going to leave them unattended. If the person you are accompanying or assisting is more independent and is allowed to be alone for some time, ensure that you've told that person where you're going, what you're doing, and when you'll be back. Hey, I'm going to take a quick face mask break. I'm going to step outside of your home. I'll be in the front yard for 2 minutes, and then I will be back. Let them know where you are, and let them know what you're doing and when you'll be back. And then once all of these things are confirmed and everything is done and it's time to take your break, take that break, step away, and remove your mask, as I stated in this previous slide. Okay, so your lunch break. How do you take your lunch break safely? Obviously, you need to eat, but we want to make sure that you do this safely to keep you safe and to keep all of the people that you are working around and with safe. Check with your employer to make sure you're aware of any existing policies. Ensure that the person you're providing services to is covered. Just like I said in the past 2 slides, this is the same as you would normally do. It's preferred that you stagger your lunch break so that it doesn't happen when other colleagues are taking their lunch break. That's because you don't want to have your mask off and them to have their mask off, because if their masks are off, you are potentially exposing each other to COVID-19. If you are sitting with someone when you're taking your lunch break, you should sit away from the person and preferably sit at least 6 feet away from the person. And then lastly, but most importantly, it really is best if you can eat outside. Less time without the mask on while indoors is always better. A number of people have asked when I've presented this slide, what happens with the people that live in this home? Can they eat their meals at the same time? So these people are living together, okay? If no one is on isolation, no one is on quarantine, if everyone is living in this home and they are believed to not have COVID, they can be sitting at the same table together without their masks on eating. It's the same as if you are living in your home. You don't wear a mask when you're having a meal with people in your home. So if you live with someone, the rules are different. And the people that you're working for are living with their roommates. Or their housemates, I should say. So they do not need to wear a mask. They do not need to stagger their lunches. They can eat together and should eat together. Okay, so we've talked about what to do before you get to work, what to do when you are at work. Now we're going to talk about what to do when you are leaving work. Be sure to wash your hands when you leave. You're going to use soap and water or squirt some hand sanitizer in your hands as you're walking out the door or before getting to your car. What I've done when I've left places is I've washed my hands in the kitchen, dried my hands, kept my hands to myself, and walked out the door. Okay. And then I have hand sanitizer either in my pocket or sitting in the car. Then I wash my hands one more time. I'm being a little neurotic because you don't have to wash your hands multiple times as you're walking out the door. But, if you wash your hands with soap and water in the kitchen, you might pass something and inadvertently touch something as you're walking out the door. So it's always a good idea to have hand sanitizer on you or in the car just in case you want to wash your hands one more time. But the main point is to wash your hands as you're leaving. And the reason for that is to get any germs, viruses, bacteria off of your hands before leaving work. You're preventing the spread from the workplace to either home or to wherever you're heading after work. If there's anything on your hands and you don't wash your hands, then you're taking it with you and potentially infecting yourself, getting the germs in your car, and wherever you're heading to next, you could potentially infect someone there. And so what are we doing when we're away from work? Remember to stay at least 6 feet away from people, okay? We want to make sure that people practice social distancing. from anyone that you don't live with. And that's because it's going to reduce your chances of getting COVID-19 and reduce the chance of you spreading it to someone who you are with every day, receiving services from you. And a great way to determine if you are about 6 feet away from someone is if your arms are stretched out to the side and the other person has their arms stretched out to their side and your fingers are not touching, as you can see in this picture below. Their arms are outstretched, their fingers are not touching each other. Um, Also, another thing to keep in mind when you're away from work, we've talked about this scenario at my job. Imagine that you live with your 90-year-old grandparent or great grandparent, and the person is vulnerable to a rapid health decline. Okay. Knowing what we know about how COVID is so infectious and can be transmitted so easily, and what it does to the body, especially if the person is weakened or compromised immune system, how would you live your life? You would be very careful before entering your home and before being near your relative and before touching anything that your relative touches. So please remember that you are caring for someone else's family member, someone else's loved one. Please care for, as you all have been doing, please care for these individuals as you would for your own family member, and take care of yourself when you're outside of work to prevent any to reduce the risk of infection for yourself, thereby reducing their infection or thereby reducing them becoming infected with COVID-19. The bottom line is we're concerned about your health and we're concerned about the health of the people that you provide services to. We want to make sure that you are thinking about your health and that you are thinking about the people around you and that you're thinking about these things before you engage in any kind of socialization with people. Please stay 6 feet away. Please wear your face masks when away from work as well. So you wash your hands when you take off your mask. You're going to store your mask, as I said, in preferably a paper bag. And when you store the mask, the outside part of the mask should be folded in. So if this is your mask and you're taking it off, you're going to fold it in on itself. That way the virus is on the inside and you're hopefully less likely to touch the virus um, when you are handling the mask. Your masks should be, if they are cloth masks, they should be washed daily. And that is and that is not just, that is in your own personal life. You want to make sure that you are reducing the risk of transmission. You don't want to wear the same mask that you wore yesterday when you are at the park or taking a walk or exercising or going to the grocery store. You don't want to wear that same mask from yesterday today, because it might have the virus on it, and you want to make sure that it's clean. Okay, so being aware of how close you are to people and what you touch, anything that you do directly impacts the health of you, of course, the people that you live with, and anyone receiving assistance or care from you. Okay, here's an image of a mask being placed inside a paper bag. This is not a cloth mask being put in here, but if you, for whatever reason, if you are reusing a medical, surgical, or procedural mask, you want to make sure that you put it in something that is enclosed but still breathable. Okay, this slide has a link for washing and drying your reusable cloth mask. You can put the mask in the warmest water temperature that the mask's fabric can take, and then you want to put it in the dryer until it is completely dry. You can hand wash with a bleach solution, but keep in mind that that could really irritate the skin on your hands. So it is totally acceptable to do the regular laundry. You do not have to use bleach solution and hand wash. You're going to dry the mask on the highest heat setting until it's completely dry, or you can lay it flat and allow to completely air dry. If you do that, direct sunlight is preferable because there are studies that are showing that the UV rays might kill the virus a little faster than just sitting in indirect sun. The numbers that I have aren't exact, so I'm not going to give you the time frame, but it's, minutes faster. So it's not an incredibly huge difference. But the main thing is you want to make sure that it is completely dry after washing it. This link at the bottom of the page, please feel free to take a picture of this page because this tells you how to wash your reusable cloth mask. Okay, remember to keep up to date with changes in policies and recommendations that DC Health puts forth. You're going to go to coronavirus.dc.gov. We are currently, at this time, we are currently in phase 2 still. And so this will be updated as new information comes about. You don't need to you don't need to enter phase 2 when you are going on the website. You can just do coronavirus.dc.gov. I did not realize it was 1:15 already. So factors that your employer should consider would be location types, who is receiving services, what are their health concerns, are they at high risk? Okay, you can certainly use the home's layout or furniture spacing to keep people further apart or to help remind them. Let's say you have 3 roommates and they like watching the TV, and there are 2 easy chairs or lazy boys and a couch in the living room. You can change the spacing of the furniture. You can separate furniture so it's further apart from each other so that people aren't within 6 feet. They are further apart from each other. You can work on timing for when people are, if they have shared bathrooms, when they're brushing their teeth, when they're washing their face, when they're getting ready for bed, when they're showering, to give time to clean the sink, the toilet, the shower before the next person uses it. Okay. To summarize, as I've said before, we have our faces covered. We are now going to be using eye protection, whether goggles or face shield. We are 6 feet apart from each other. We are washing our hands correctly and frequently and thoroughly with either soap and water or with hand sanitizer. And please do not touch your face. I am surprised that it's already after 1:15, so I'm going to just go over to the resources page. You can visit cdc.gov/coronavirus. You can visit dchealth.dc.gov, or you can visit coronavirus.dc.gov. I'm not sure when this is going to cut me off, so I'm going to I'm going to check out a number of these questions and see what I can answer in the time that I have remaining.
Hi, Michael. This is Kirk. You have until 12:30. Sorry, 1:30 to continue. If you would like, I could read out some of the questions to you if that's easier.
I actually have the questions pulled up, so I can just read the chat if that's okay, unless you see a certain question that you want me to work on first.
Nope. Do whatever you think is best.
Okay. So I talked about the question that was asked about the valves on the masks. And the answer to that question is that they're telling us that we should not use the ones with the valves, basically. So the answer is going to be don't use those. Will we send the PowerPoint? This will be available on our website. Somebody said sneezing or coughing into your elbow is not hygienic given the mode of transmission for COVID-19. For example, if someone with COVID sneezes or coughs into their elbow and someone touches that person's elbow and touches their face, nose, or mouth, the potential of getting the virus thus exits. Okay, so the person is saying that if you cough into your elbow or sneeze into your elbow, that it's not hygienic. You're absolutely right. However, if you don't have a tissue or you don't have something, it's better, it's taught to sneeze into your elbow or to cough into your elbow instead of your hands. That's why we shouldn't touch people. And if we do touch people, wash your hands afterwards. But I do understand that that is not ideal. Ideally would be in a tissue. Someone asked here, you said the patient must consult a PCP before ending the isolation. Does it mean 14 days is no longer the standard duration to end quarantine? So quarantine is 14 days. Let me pull my, you're going to want to go to the standard that the communication that DC Health put forth. It is called the Guidance for Healthcare Personnel, Personal Protective Equipment, Monitoring, Restriction, and Return to Health. So please visit that document to see the current information on when isolation and when quarantine is ended, but it is no longer testing. Okay, so in the example that I gave, it said that if the person tests negative within 10 days of being exposed, can they end their quarantine? No, that it currently is stating that it must be the full 14 days. Okay, someone else asked, if a person travels for a medical appointment to a high-risk state, should that person self-quarantine? You should review your policy. If the person is going to a high, I believe you asked if the medical appointment is to a high-risk state, should that person self-quarantine? Well, we need to see what they did when they went to this medical appointment. We are very close. We are DC, Maryland, and Virginia, so it's easy to go between states or areas. So I believe your team, the IDT, the interdisciplinary team, should talk about that and how to address going to an appointment in an area that may be high risk. If asymptomatic, taken test and on quarantine, but results come back negative, do you get off quarantine? No, quarantine is 14 days. And then the person wrote high risk state. Okay, somebody asked, when is the face shield required? You need to go to the September 15th information that is given to us by DC Health. And again, that's called Coronavirus 2019 COVID-19 Guidance for Healthcare Personnel, Personal Protective Equipment, Monitoring, Restriction, and Return to Work. I need to direct you to that page because that will tell you when and where, in what settings you should currently use a face shield. Can face shields be sanitized and reused? The simple answer to that question is yes, they can be reused. They should be reused by the same person. So if I am coming to work on a Monday and I'm using a face shield on Monday, I'm going to wash it at the end of my shift, at the end of the day on Monday, whatever time I leave, and then I'm scheduled again on Tuesday or on Wednesday, I can reuse that face shield. However, it should only be me using that face shield. So I'm going to scroll back to one of the images in the beginning of this presentation. You will see on this image that there is, on this picture on the right, it says name, and there's a blank space. So I'm not telling you where to use. DC Health is going to clarify specifics on requirements for face shields and eyewear. However, you should be able to label whose face shield belongs to whom, which face shield belongs to which person. So if you look at these pictures, there placed name written, but you could put on a sticker, you could write it in Sharpie, making sure that The face shield is used by one person and one person only. So can they be sanitized and reused? Yes, by the same person. At the hospital, we use the same one until it is damaged. Okay, great. Yes. So I would think that that the face shield uh, also, well, considering supply and demand, considering the cost of the face shield and how many the providers have, they are effective until they are no longer effective, meaning they have not been damaged. Will there be guidelines for required testing for DSPs? We should remain vigilant and eyes and ears open for any changes that DC Health may put forth. I do want to tell you all that you can go and register for new information to be sent to you via email. If you go onto the CDC website, and you go onto DC Health website, you can receive emails for new information. Also, if you go onto DC Health and you go under phase 2, you go to coronavirus.dc.gov and you follow the phase 2 links, there should be a what's new page that will also provide you with what's new. So you can see any new guidelines that have been put forth regarding testing for DSPs, regarding eye covering, regarding new information for what is acceptable eye covering. That should all be there. Somebody said supported living homes are not healthcare facilities, which is why I asked when the face shields are required. There was some discrepancy during the Friday meeting, and I believe Mr. Woodland was going to speak with Ms. Mebane offline. That is correct. As of right now, we can only go with what we have. So what we have is that we should have face shields until more specifics are provided to us. Unfortunately, that's all that I have to give. You're welcome. Okay, we have about 2 more minutes. Any other questions? If the National Guard requires 7 to 10 days quarantine, why does everyone else require 14 days? That is a great question, and I don't have an answer for you. DC Health has stated 14 days, and so that's what we're going by. Very, very good, very interesting question. Great point. 14 days is the answer. I have to go with what CDC and what DC Health is stating. Any other questions for you? Any other questions from you for me?
Michael, thank you so much for this presentation and training. I think you did an absolutely great job. I also want to thank all the folks who came and attended today and participated with your questions. I will be sending an email out to all providers shortly after this with instructions on how this should be used and training all staff, including all DSPs, as well as the requirements for refresher trainings that are going to be required of all providers in the upcoming weeks. If you have any questions, please reach out to the assigned QRS or to me directly. Again, this is Kirk Dobson, Deputy Director of DC's Department of Disability Services for the Quality Assurance and Performance Management Administration. And feel free to reach out to me with any questions. And again, thank you so much for your participation. And Michael, thank you so much.
You are very welcome. Thank you. Two other things. Somebody said, will CEUs be provided for nurses for this presentation? We do not have CEUs for this, but I will look into what we can get as far as COVID-related CEs for any future trainings. Also, I want to, thank you for the compliment. I appreciate it. I thank you very much. I'm so happy to see that we have 128 people on this call. That's amazing. Very happy to see that. In case you missed it in the beginning, please put your name. If you haven't already, please put your name, your title, and your provider in the chat box, not in the Q&A, but in the chat box so that we have your name on here stating that you were in this training. Thank you so much. I'm going to wait just one more minute so that you all can type in your information, and then we're going to close this training. Thank you so much, and please reach out. As Mr. Dobson said, please reach out if you have any questions. Please reach out to him. And thank you all so much. Please stay safe, stay healthy. I should have said this in the beginning. We appreciate everything that you all are doing. Thank you for all of your hard work, really. Thank you so much. I'm about to disconnect, so if you need to write in any of your information, one person just wrote something at 1:29, but they didn't include their title or their, very good. Thank you. Thank you for including that. Okay. Thank you, everyone.